Hello, my name is Donna Collins. Today is March 6, 2025, and I am going to discuss the Netflix 2017 documentary Heroin. It was a 40-minute video or documentary that I watched yesterday for the very first time. I am addressing several items in this video, and I am specifically speaking to Fire Chief Greg Fuller and Administrative Assistant Karen Wright. My name is Donna Collins. I'm the CEO of Crystal Clear Transitional Care, an advanced clinical practice research firm located in St. John, New Brunswick. I'm going to tell you my background and then we'll get into your video. So, my background. I have a nursing degree from the University of New Brunswick, St. John campus in 2000. And I also have a nurse practitioner degree from Athabasca University in 2012. In 2000, I worked at the St. John Regional Hospital. That's where I first encountered my first person who had infective endocarditis secondary to IV drug use. She was very, very sick, and she was tethered to the bed like a dog. We did not give her any Narcan Nasal Spray. We did not give her any methadone for opioid use disorder, and we certainly didn't have any Narcan Nasal Spray on our crash carts back then. In 2004, I went to work at the St. John Regional Correctional Facility, and that's where I saw a ton of people addicted to opioids and admitted to jail. Shameful. Opioid addiction is not a crime. It is a physical, chemical addiction. Between 2004 and the end of 2012, I could not prescribe methadone, and I had no Narcan Nasal Spray. So I left the jail. I could not help people. Women in the jail told me they had to get pregnant in order to get methadone. That is disgusting, not to mention unethical. We had hanging deaths, and people died upon release. They could not get methadone, and they certainly did not get any Narcan Nasal Spray from me or anyone else. There is a pattern of opiate withdrawal, relapse, death. Opiate withdrawal, relapse, death. There is a pattern. That is why we need to treat people with the gold standard methadone. In July of 2016, I imported Narcan Nasal Spray, the antidote to opioid overdose, into Canada. In early August 2016, I had $6,000 worth of Narcan Nasal Spray in my house. That's how quickly it came, and I started dispensing and distributing across Canada. So who has Narcan Nasal Spray, you ask? Well, Canadian fire departments, police, RCMP, sheriffs, correctional facilities. It's in AED machines. We have it in the St. John Airport. We have it in Costco AED machine. We have it in the Main Street Post Office. St. John Ambulance is training to use Narcan Nasal Spray. We have it in the St. John Courthouse and the Fredericton Courthouse. Cintas has gone on board with Narcan Nasal Spray. We have it in malls. And of course, I distribute it to people who I know who are prescribed an opioid. So, I am going to also talk about some experiences of opioid overdose that I have come across. We have a dead young child from a methadone overdose in New Brunswick. No Narcan Nasal Spray or naloxone was given by paramedics. We have methadone overdose in jails. That's captured on YouTube videos. We have a dead teacher secondary to a simple Tylenol 3 overdose. No Narcan Nasal Spray or naloxone of any kind was administered by advanced care paramedics. That teacher got the casket treatment. That teacher was also given ketamine in the resuscitation. Ketamine is an opioid until new evidence demonstrates otherwise. I got tramadol reclassified in Canada using the American Credible Meds list. Methadone was the only opioid on the American Credible Meds list when it first came out, or when I first started following it in 2014. Other opioids have been added since. Loperamide is on the American Credible Meds list. I have reclassified loperamide as an opioid using my years of clinical experience in the St. John Regional Correctional Facility. The American FDA called loperamide poor man's methadone. No, it's not poor man's methadone, but at least they were comparing two opioids. Loperamide is and can be purchased in any corner drugstore. It is not a controlled substance, but it needs to be. So we didn't have drugs in the right drug classification. We've got drugs that are not controlled, and we have people dying in the streets because we didn't have any Narcan Nasal Spray. We have a dead teacher secondary to a fentanyl patch overdose in Ontario, secondary to a botched hip surgery. No Narcan Nasal Spray or naloxone was administered. That nurse is dead. So we are still struggling about the management of opiate overdose. And this really does need to stop. Through my research, I have determined that opiate overdose might be secondary to lethal drug-to-drug interactions or a low hemoglobin level. And I will talk more about this as it pertains to your video. So let's move along now to your video. It was very well done and very informative. And early on in the video, I noticed that Jan had come across an opiate overdose person, and one of the firemen came out with what appears to be a methadone bottle and a spoon and syringe. Thank you. That would be a preventable death. We could have done maybe some follow-up to see who prescribed that methadone or where the methadone came from, and why did that person overdose and die, or overdose. I think he died. So your little town of Huntington, West Virginia, has been classified as the overdose capital of the United States. There was discussion about the number of deaths within that video. I would say that perhaps Vancouver, Canada is the opiate overdose capital of Canada. The day that 100 people died of opiate overdose in the streets of Vancouver, and the mayor was on the national television crying, practically, somebody out there, help us, help us. And that was the day that 100 people died. Shameful, and this needs to stop. Drug court. We need help in drug court, obviously. People do not need to go to jail. They need treatment. Again, methadone is the gold standard in opiate replacement therapy. It's like the girl said on that movie, why do I need to go to jail? It doesn't treat the root cause, and that is a true statement. Jail is not the place for people. We don't send insulin-dependent diabetics to jail when they relapse, and trust me, they relapse. How many times did I have to treat high blood sugar because an insulin-dependent diabetic chose to eat a chocolate bar that day? So high blood sugar, insulin-dependent diabetes, people relapse. When we put people into opiate withdrawal, they relapse and die. I do not want to see any more judges and that judge court to continue in that manner because people died as a result. The gold standard, once again, is methadone. And I'm asking you, please, after people have overdosed once, they have a propensity to overdose again. It could be they might have a low hemoglobin level, they might have some other underlying condition, drug-to-drug interactions, who would know? We don't know always the reason that people overdose. that Huntington, West Virginia is a blue-collar town. Welcome to blue-collar towns. Of course, these are legitimate injuries. Of course, these people got opioid addicted. Of course they did, and now we need to expect opioid addiction and treat it before it gets out of hand. We have people who are back to work in St. John, New Brunswick, who are taking methadone and going to work every day. Now we need to get other people back to work and leading productive lives. I think that is probably the highlight of the video, although I could talk about the video for another 10 or 20 minutes. If you have any questions, you feel free to contact me, Fire Chief Fuller. I gave you my email address today, methadonecollins@icloud.com. And this will end my video for today. Have a good day. Talk soon.